sections, UV, visible light, and then infrared light, exposure. So if you look at the spectrum, there's the visible light, which is there in the middle, which we can see. On the right side, you have infrared, and these are longer wavelengths, lower energy. And you go farther out, there's microwave and radio wave. And you go to the left, there's the ultraviolet, X-ray, gamma rays. They're higher energy, shorter wavelengths. And those are the ionizing radiation. Those can cause cancer, or can damage your DNA. The ones on the right, they're a non-ionizing radiation. And so we're going to break this down, though, starting with ultraviolet. And then we'll go to the visible spectrum, then we'll go to infrared. So that's how we'll break it down. So any benefits from ultraviolet light? What would you say that are the benefits? Is there a benefit, or is it just all bad? Because you can get I've had skin cancer, so I know we're going to be cautious with that. But are there any benefits to ultraviolet light? It kills bacteria, okay? Vitamin D. Very good. There's a little feedback. I don't know if you can turn it down just a little bit. So yeah, so it produces vitamin D. It also produces nitric oxide. And we'll come to that in just a little bit. Does UVA or UVB help make vitamin D? Which one of those is the ones that helps produce vitamin D? Anybody want to venture a guess? B, it's UVB. UVB is what you need to make vitamin D. And which one is blocked by windows? Like your car window, these windows will block either UVA or UVB. So it blocks actually UVB. So you can get vitamin D if the sun's coming in through the window. It blocks you. You can still get a suntan or a skin cancer, but you won't get vitamin D sitting inside a window. So can you make vitamin D without the sun? You're going to get it in pill form, but outside of pill form, you actually have to have the sun to make vitamin D. So this is a little graph here. Sun comes and it hits the epidermis, and there's a cholesterol-like substance that is then turned into vitamin D, then goes in the bloodstream to the liver as 25 hydroxy vitamin D, and then it goes to the kidneys to make 125 dihydroxy vitamin D. And when you check your blood level for vitamin D, it's what's in the bloodstream. It's the 25 hydroxy vitamin D. It's not the actual active form of it. But that's how vitamin D is made, unless you take it in pill form. So the benefits of vitamin D. What we think of vitamin D helps us with what? Yeah, I heard calcium and bone strength, and that's the one thing we commonly think of. But it has lots of many things that it actually helps with. And say again? It helps you with your immunity. We're going to talk about that. Yeah, it helps with your immunity. And it's a fat-soluble vitamin, and so it actually penetrates past the lipid layer in your cells and gets into the nucleus, and is thought to regulate over 200 genes and the expressions of the proteins that are made. So it has a potent effect beyond just calcium absorption. So a question for you: why do we get sick in the wintertime? We don't get as sick commonly in the summertime. What is it about the wintertime? Okay, I'm hearing a few different things here. We do get together, right? Okay. So I'm hearing we're closed up in a house. We're a lot of family gatherings. The air is not fresh. I'm hearing some things on sunlight. So why do we get sick in the wintertime? Is it because we're indoors, family gatherings? So if you look at, this is from the CDC, looks at over a 40-year period, the months of the year that you had the highest rates of influenza, and it was during the winter months. So February more common, but this is just like per year, what month was the most common? And out of 40 years, February is more common. But from December to March were the main months you would get flu. And you look here, let me put my laser pointer on here. And you can see how this is influenza from the CDC, how it peaks in the wintertime, and the summertime not so much. So we definitely see that's the trend, which we already know. And this is a study out of Harvard, the Kennedy School. And they noted as vitamin D levels, I'm going to highlight here, vitamin D. See this graph? I don't know if, can you see my laser? Yeah, you can. Okay. See how as vitamin D levels go down, then you start getting peaks in influenza. And they associated this, and they looked at the CDC data for influenza and combined it with solar radiation data. And they found that, this is a quote from their paper, we find that sunlight strongly protects against getting influenza. If you look, so let's look in Australia. So Australia is just, they're in the southern hemisphere, and their winter times are in the summer months, right? Their cold times are in the sun. So they get less, you'd expect if they get less sunlight in those summer months, that they would have more influenza. This is influenza in Australia, southern hemisphere. And you can see it's during the summer months that they have their peaks of influenza. So it's not really, although fresh air is an important thing, it's probably more of a sunlight issue. That so northern hemisphere is during our winter months, and the southern hemisphere it's during the summer months that they have more common influenza. If you look at Singapore, which is near the equator, it's all over the place. There's not really a real cycle to it. So the influenza is the middle graph here. Pneumonia, influenza, that's all over. There's not a cyclical pattern there. Interesting. This is a small graph, but I'll try to highlight. You see, this is different diseases, heart disease, cancer, but there's a cycle to all of them. I don't know if you can look up there and see. So this is, you see heart disease there. This is the top one. See how there's a cycle? And when is that peaking? Can you tell? In the winter months. So it's peaking in the winter months. Cancer, there's also a little bit of a cycle to that. When is that peaking? Winter months. Strokes. You look at all of these, there's a little bit of a cycle to all these when people die from these things. Strokes, chronic kidney disease, Alzheimer's disease, and the rest. That there's a cycle to these things, and it's associated with the months, and we think it's really associated with sunlight exposure. So vitamin D. So what percent of the U.S. has normal vitamin D levels? If you look at, a lot of labs will have it as 30 nanograms per milliliter. Any guesses what percent of the U.S. has normal? 20%. So the guess is 20%. 40%, yeah, right in there between the two of you. About 35% of the U.S. has normal vitamin D levels. So the majority of us don't. If you're like me, I don't get out as much as I should. So is 30, that's the cutoff you'll see in the labs. That's been well validated for bone health. So if you get over 30, that's been well validated for bone health. There are studies looking at all-cause mortality, and you kind of see how it comes down here. It starts to level off when the levels get to around 40 or 50. So there might be a subtle benefit getting a little higher than 30, maybe up to 40 or 50. So you see at 100 to 125 there, it starts leveling off. Same with, this is a composite disease, similar around 40 or 50, there it starts to level off. So 30 has been well validated for bone health, maybe for all-cause mortality a little bit higher. You do have to be careful because vitamin D is fat soluble, it can cause toxicity if you have too high. If you get above 100, it's considered too high, and that can lead to increased calcium intake and all the side effects that go along with calcium. You can have kidney stones, and it can affect your mental health, and it can calcification in arteries and different things. So nausea, fatigue. So how much vitamin D should you take? This is from the National Academy of Medicine. They suggest 600 to 800 international units a day. If you're deficient or you're limited to sun exposure, maybe 1,000 to 5,000 international units a day. And of course, you want to check your levels. If you're taking vitamin D, it's probably a good idea with your primary care doctor just to check them, just to make sure you're not too high or too low.
Is there a recommended supplement?
Is there a recommended supplement? I don't have one that I would say. I think they're all fairly good. I can't say one versus the other. Dr. Tryon, I don't know if you have any comments to that. I don't have one that I would say one vitamin D over the other. Okay, no, we don't. So how much time do you need to be outside? If you're not taking it in a pill form, how much time do you need to be outside to get adequate vitamin D? Anybody want to venture a guess? 1 hour, 15 minutes, 40 minutes. Okay, so it really depends on your skin, if you're lighter skin or darker skin. So the NIH suggests 10 to 15 minutes in lighter skin individuals. Darker skin, maybe 30 to 60 minutes. So it really depends on your skin tone. And these are numbers based if your shadow is shorter than your height. So kind of during the middays, if at the end of the day, remember ultraviolet rays are these short wavelengths. And if it's coming through a lot of atmosphere, it gets blocked out. Whereas infrared will penetrate, the ultraviolet rays gets cut out earlier and later in the day. So between 10 a.m. and 4 p.m. is when you get a lot more of the vitamin D. And during the winter months, if you're below the 37th latitude, so we're just below there. So you can still get adequate vitamin D, but we're right on the line. Above that line, you can't get enough. You don't get enough sun exposure to get adequate vitamin D. So, what do you think? What is the better way to get vitamin D? Is it through supplementation or through the sun, if you had to guess? Okay, sun. Okay, well, so there's a couple studies that go along with this. This is from COVID, and they looked at people who came into the hospital, and they looked at their vitamin D levels. If it was less than 12, they followed this red line for mortality. If it was greater, it was up here. So the lower the vitamin D, the higher the risk of dying. And if you look at this was a systematic review pulling out a bunch of studies. You were 2.5 times more likely to die if you came in with low vitamin D. And that is probably more a measure of what people are like that are outside more than supplementation, they suspect. Whereas, and the greater the severity correlated with hospitalization and intubation, ventilation, and death, mortality, 2.5 times higher risk of dying. So supplementation after you got COVID, there was more mixed results. There was some benefits, more so in people that were vitamin D deficient. So it's probably, I would suggest the sunlight is probably the preferable way to get. Like these studies suggest mortality was much more beneficial if you came in with regular vitamin D, high vitamin D levels or normal vitamin D levels. And when you supplemented after the fact, it was not quite as effective. So the other benefit of UV we talked about is nitric oxide. There's in your skin, nitric oxide is released. And as you get exposure to the sun, you get nitric oxide. And this is looking back many years. And if this is a little bit maybe hard to understand, but 0 is at the equator. And the farther you go out from the equator, it looks at blood pressures compared to latitude. And the farther north you go, back in 1975, you had about a 10-point rise in your blood pressure. So if you're closer to the equator, your blood pressure tended to be a little lower. As you're getting farther away from the equator, blood pressure was worse. Now we have a lot more medications, a little bit more tightly controlled with medication, so you don't see quite the same difference. So you see in 1975 was a bigger difference than 2015. But there was these studies that show the farther you go away from the equator, the worse your blood pressure, also the worse your cholesterol. So there's some benefits for blood pressure, nitric oxide, and there's something with cholesterol as well. As you go farther away from the equator, the worse your cholesterol tends to be. So avoidance of sun exposure is a risk for all-cause mortality. And so this was a 30,000 subject study, and they looked, this is in Sweden, they looked at sun exposure, and they divided them into people who avoided the sun, moderate sun exposure, or kind of active sun exposure. And mortality was two times higher in those who avoided the sun. And they compared sun avoiders had a similar life expectancy to smokers. That was kind of the headline that came out of here. If you're not getting sun, it's as bad as smoking is kind of what the press release came out of this study. So you look here, avoiding the sun, cause of dying from cardiovascular disease, cancer, or other causes was higher. If you got moderate sun, less, and sun avoiders was, avoiding the sun was highest with all those causes of death. Moderate was in the middle. And if most active, there was less risk of cardiovascular, cancer, and other causes of death. So interesting, the more sun, the better the likelihood of living. This is a similar study, 400,000 individuals from the UK, so in England, Biobank. And they did a 13-year follow-up. They looked at ultraviolet exposure, either being outside or in these solariums. I guess these rooms that have a lot of windows, and they measured that. And they noticed that this is again a measure of all causes of death, whether all-cause cardiovascular here, cancer, and non-cancer causes of death. And one is neutral, like there's not a benefit or a harm. Below one is there's a benefit. And so whether solarium or outside, there was a benefit in almost every category of all causes of death. So there's some benefit of getting outside or having these rooms that have windows there in the UK. And interestingly, so we get outside. I've had skin cancer, so you want to be kind of cautious. And so in this 400,000 folks in this study, there was a trend towards more melanoma, but it was not statistically significant. The one is kind of neutral, so the confidence intervals overlapped one, but clearly the mortality was not any worse. So it looked like even better. If you look at non-skin cancers, the mortality was protective, like sun exposure was protective in those individuals. So getting outside is protective, maybe not for melanoma and skin cancers, but mortality from other causes of death. So you highlight that there. And so this was their synopsis. It says, we have shown that increased sun exposure correlates with significantly reduced all-cause cardiovascular and cancer mortality. Richard Weller from UK. So we talked UV, the benefits we talked about, vitamin D and nitric oxide. Why do people get sick during the wintertime? Sunlight. It's probably a sunlight thing. Fresh air is also helpful. It was brought out. Optimal level for vitamin D. So on the lab values, probably that's been well validated for 30, but there might be some benefit up to 40 or 50. You do want to be cautious not to get too much vitamin D. Interestingly, if you go out in the sun, your body has a mechanism. You cannot get too much vitamin D in the sun. Your body will stop producing vitamin D. You can take too much vitamin D, but you don't get it. Your body has a mechanism not to give you too much. And smoking had a similar mortality to what? Yeah, the people that avoided the sun. Yeah. Okay, so we'll move on. We talked UV. We'll talk about the visible spectrum. So how much? Yeah, I think when they're looking at that, they're looking at people that are wearing have some arms and legs exposed, like the 10 to 15 minutes, or for darker skin, 30 to 60 minutes. People wearing clothing with maybe arms and legs exposed, I believe. Yeah. So visible, any benefits to the visible spectrum? Anything you can think of that there might be some health benefits? And there's quite a few. Yeah.
Should take that on your back.
Okay. Okay, she's making a comment that vitamin D is best made when it's exposed to your back. Okay. And Greg, were you going to say anything? No. Okay. Any benefits to visible light?
Your eyes.
Oh. You get, there are some benefits to the eyes of light, the visible light specifically, but you get it through all your skin produces vitamin D in any part. So, but yes.
And feedback on that, in the morning sun before the sun is actually up, light is the best for your eye.
Yes, so he's talking about light exposure early in the morning. So we're going to come, you're reading my mind here. So the benefits, it helps circadian rhythm. It turns off melatonin, like your melatonin is when you're sleeping, right? And then once you get light, it turns the melatonin off, tells you it's time to wake up, and it turns on cortisol. And cortisol we think is bad, but it's actually good to have a peak early in the morning, not kind of a steady high. It kind of peaks in the morning, then it kind of lowers down. It kind of tells you it's time to wake up. And then, so it's good to have that light exposure for your circadian rhythm, turns off melatonin and turns on cortisol.
How much time?
So 10 to 30 minutes probably within the sun is adequate. Yeah, early morning. Yep. And so it's in the melatonin is produced in the pineal gland. And interestingly, there's these intrinsically photosensitive retinal ganglion cells that are focused on the bottom of the back of the retina, like where you get sun. Like that's just how God made us. And then it goes on, it either If you get sun, it turns off the melatonin. If you're not getting sun, melatonin is being turned on. So the downside of night shift work, we're talking about getting exposure to lights. There's less sleep time, poor quality of sleep, increased insulin resistance, risk of type 2 diabetes goes up. These are all from a number of studies. Increased appetite and weight gain, decreased immune function, increased high blood pressure, heart disease, stroke, decreased alertness and memory, depression, anxiety goes up in night shift workers. And the World Health Organization describes night shift work as a class 2A, which means probably carcinogenic if you're working at night. Now, we need people in the hospital and different places working at nighttime, but these are all the downsides of having to be up at night when it's better to be sleeping. So if you're like me, I oftentimes have my computer on right before I'm going to bed, or your phone, probably the bigger thing, the phone. So this is a study looking at e-readers like a Kindle or your iPad, and how it negatively affects sleep, circadian timing, and next morning alertness. So if you look here, this is the ebooks and this is irradiance, and you can see that there's more exposure with the e-readers. The printed book, there's really nothing, next to nothing. And you take longer to fall asleep. If you're reading a regular book, maybe around 15 minutes. If you have the ebooks, it's probably 25 plus to 30 minutes to take to fall asleep. So there's an impact on your ability to fall asleep. This is again, it turns off melatonin when you have the light exposed. This was a study out of the UK Biobank, and they had light sensor watches for a week, and they repeated this down the road, but there was an 8-year follow-up, and they tracked mortality. And so if you look here at this graph, again, 1 is kind of neutral. It's not protective. It's not harmful. If you go above, it's harmful. If it's below, it's helpful. So during the day, light exposure, they measured off of a watch, was actually beneficial for all cause of death. It was beneficial if you got light during the day. You come around, say, 9, 10 o'clock, it starts getting back to neutral. And especially at nighttime, people that were exposed to light at nighttime, their risk of dying went up. So interestingly, this is something we've heard before, like light exposure at night, not helpful. Late 1800s, this is a quote, late 1800s, it says, make it a habit not to sit up after 9 o'clock. Every light should be extinguished. The turning of night into day is a wretched, health-destroying habit. And this is from manuscript releases. It goes on to say 1 hour's sleep before midnight is worth 2 hours after midnight. There's some benefit of turning the lights off, getting to bed, and we were told, this is over 100 years ago. So the ideal is to avoid light at nighttime. You want a dark room if you're falling asleep. The ideal, and I don't do this myself. I need to do better with it. But 2 hours before bed, you want to avoid blue rich light like phones, tablets, TVs, LED. Those are potent melatonin suppressors. Melatonin is suppressed 70 to up to almost 100% with exposure to those, and it lasts 50% reduction even 50 minutes later. So it may take an hour or two for things to normalize. And if you have to use light, the warm red light below your eyes, because that's where the retina, above your eyes, it's worse. It's getting those retinal cells that turns on or off the melatonin. And you want a dark room for sleep. So light at night, it leads to sleep disruption, muscle loss, bone loss. Cortisol levels are higher, testosterone levels drop, and these are a few studies that go along with that. So light at night is not helpful. And what should we be doing in the morning? And this was already mentioned here. Sunlight before 9 a.m., maybe 10 to 30 minutes is helpful. It helps with earlier sleep onset, better sleep quality, less fragmented sleep, more alertness the next morning. And it just helps with your sleep, your circadian rhythm. So if you're like me, sometimes, especially in the winter months, I'm going to work, it's dark, I come home, it's dark. Like, what do you do in that situation? Well, there is some other alternatives. So you can get these SAD lamps, they're called, for like seasonal affective disorder. They're 10,000 lux lamps. And you do 20 to 30 minutes, like a foot and a half in front of your face, 16, 18 inches in front of your face. Or you get these blue light glasses rhythm for about 30 minutes, and it sets your circadian rhythm. It tells you it's time to wake up, and it turns off the melatonin, it peaks the cortisol. So I actually had intended to bring one of those light boxes and the glasses, but I forgot them at my house today. But here's the comparison. So sun can have up to 100 lux. That's really the best. If you can't do that, you can get these light boxes or sad boxes that are 10,000 lux. Or you can use these. I find these glasses good because they're not quite so bright, because the boxes are pretty light and you can kind of read, have devotional, and so forth. Indoor lighting, not sufficient. So that doesn't tell your body to turn off the melatonin and set the circadian rhythm.
What do they mean?
They are AO glasses, AYO. I think there's some other brands, but that's the one that is mentioned there. They're in the blue light spectrum. It tells your circadian rhythm to turn off the melatonin and turn on the cortisol. Question in the front.
What?
So cortisol will wake you up in the morning. It tells you it's time to go. It's kind of a stress hormone. It's really not good to have it elevated the whole day, but in the morning you want it elevated.
Can you supplement protein for a while?
Yes.
Thank you, buddy.
Ooh, okay. I don't. So the question is, if you take melatonin, does your body turn it off? I'm not aware of that. So I don't know that. I've never seen that. So light also has an impact on the sex hormones. So gonadotropin releasing hormone, luteinizing hormone, follicle stimulating hormone, and those lead to like testosterone in guys and the estrogen and progesterone in females. And so light has a powerful impact on those. So I have interesting studies. So luteinizing hormone following light exposure in healthy young men. So what they did, they gave them bright light, just 1,000 lux. Those light boxes are 10,000 versus dim light. And they did it for 5 days, 5 to 6 in the morning, so for an hour. And the luteinizing hormone, which is a precursor to testosterone, it went up by 70%. So it had quite a profound impact on testosterone. As opposed, the topical testosterone that's prescribed, there are downsides to that. It turns off your luteinizing hormone, and your body stops producing a lot of its own testosterone. You get some atrophy, testicular atrophy, and it can be converted into estrogen and get enlarged breast. And so there's a concern sometimes with potential for cardiovascular risk if you use that. So this would be a kind of a more natural way to bump up testosterone levels. And then similar studies with females, a light box, 4,300 lux, 16 inches in front of the face for 45 minutes for 1 week versus a control. And the concentrations of luteinizing hormone and FSH were significantly increased and improved their cycles. So this is interesting, living on the eastern side of a time zone. So if you're, say, in Maine versus out in Tennessee somewhere where there's a difference if you get light earlier, like there's about an hour difference from one side to the other. Light comes up earlier if you're on the eastern side of a time zone versus the western time zone. And they found here that you got 19 more minutes of sleep if you're on the eastern side, like when the sun comes up earlier. So there's benefit getting early sunlight. There was improved cognitive improvements and improvement in cardiovascular health. So living on the eastern side of a time zone versus the western time part of the time zone. And we think we have daylight savings time. So in the spring, we spring forward. So what was 6:30 in the morning now becomes 7:30 in the morning, right? And so light comes up, we get light a little later. And because of that, and these studies, the American Academy of Sleep Medicine, they actually recommend eliminating daylight saving time and adopting a permanent standard time because there's health benefits of getting early light instead of getting it late. So light and depression. See how much time we have here. So light and depression. There's been some studies comparing light versus Prozac and SSRIs and for seasonal affective disorder. And 2/3 of the people respond to both of them for their moods. The only difference was light worked quicker. And these are 2 studies showing the same thing. So that's a quick overview. We talked UV, we talked visible. Now we'll move on to infrared. So are there any benefits of infrared? And over half of the photons from the sun are in the infrared spectrum. So a lot of the energy from the sun is actually focused on infrared. So infrared is in the wavelengths of 700 to 2,500 nanometers. It penetrates the mitochondria with increased energy, ATP production, and less oxidative stress. So this is a little bit of a busy slide, but I'll just try to briefly highlight. Sun comes in. This is a mitochondria. Sun, the infrared specifically penetrates fairly deep, and it activates the cytochrome C oxidase, and it enhances. If you remember from biology class, there's glycolysis, you get glucose, then it goes on to the Krebs cycle, and there's electron transport change, which produces all the energy. And so the infrared exposure helps the electron transport chain enhance electron flow, improve proton pumping into this inner membrane space, which then helps ATP be produced more easily. So it makes more energy, ATP. There's less free radicals, less electron escaped, and there's less free radicals, and there's less oxidative stress. And going along with this, melatonin, is it a hormone of night or day? Night. We're thinking melatonin is a hormone of night. Interestingly, though, this study, this is a little small print for me to read here, but it says mitochondria is produced, this is in melatonin research, it's produced in many cells. The only cells in the body that don't have mitochondria are the red blood cells. But in many cells, are produced in quantities, as well as melatonin, which are in orders of magnitude higher than that produced in the pineal gland. So actually, within your mitochondria, there's a lot more melatonin produced than what you get at nighttime. And probably about 5% produced in the pineal gland is for nighttime. Mitochondria produce about 95%. It's a potent antioxidant. You look at the antioxidant vitamins A, C, and E. E is probably the most potent antioxidant, and it's probably 30 times more potent than E is as an antioxidant. And mitochondrial dysfunction has been associated with aging. So from age 20 to 70, you lose upwards of 50% of the mitochondrial energy and capacity. So aging, highly tied to mitochondrial dysfunction, less energy, more DNA damage, reactive oxygen species, and so it's been the mitochondrial dysfunction has been the hallmark of aging. There is emerged as one of the key hallmarks of aging, and skeletal muscle aging in the mitochondria, a decline in muscle mass and strength, what you see in sarcopenia, is a hallmark of aging process, and the mitochondria is thought to be at the center of this process. So how does near-infrared and melatonin produced in the mitochondria in response to infrared is a potent antioxidant to help with this, as well as the cytochrome C oxidase. So how deep does infrared penetrate? Anybody want to venture a guess? 3 inches. Okay, very good. Somebody has been studying. I asked Google, and it said 2 up to 2.7 inches. This is a study showing up to 8 centimeters or about 3.5 inches deep. And interesting, the darker your skin, maybe a little less penetration than lighter skin. But this is a study that looked at longer wavelengths, infrared penetrating the entire body. So these long wavelengths, this came out a year ago. And they looked at light, and they had a receptor in the back. And they found that there's a little bit that most of it gets absorbed in the body, but a little bit will actually penetrate the entire body. And the wavelength was up around 800. And so what they did, they did infrared light at 850 because they found like that penetrated the deepest. And they had a control group, a group that had exposure to the entire body, and then a group that had body minus the head. And then they looked at how good the eyes were at looking at color. And interestingly, they found that both groups that got infrared did better, even if we were not exposing infrared to the eyes. So even to the trunk, the body, there was some kind of remote mitochondrial signaling that improved the sensitivity of red and blue light perception, whether it was given to the entire body, including the head, or just the trunk. So it penetrates deep. It penetrates clothing. This is a study looking at the amount of clothing, and a lot of clothing. You have to have like numerous 12, 13 pieces of clothing to block infrared. So even if you have a shirt on, you're outside, you're getting near infrared. You don't have to have your shirt off or anything to get near infrared. Denim jeans here were blocked the best, but most people are not wearing 2 denim jeans. Bottom line, it penetrates clothing. The other interesting thing is that infrared is highly reflected by nature, like trees, shrubs, grass. This is a picture here of summertime, and you can see if you ever step on asphalt at summertime, it can be really hot, right? Or a building can be very hot. If you touch trees like the leaves, or you walk on grass, it's not so hot because infrared is highly reflective. So if you're just sitting in nature, not in direct sunlight, you're getting quite a bit of infrared exposure. And this was a study that looked at infrared lowered your glucose levels. They had people drink some sugar. One group got infrared, the other group didn't, and by 27% it decreased your glucose levels because, remember, energy is produced from glucose, and it goes down to the electron transport chain to produce energy. So it's more efficient at using glucose with near infrared. This is a systematic review looking at outdoor green space, and there was less type 2. This is a systematic review of many studies, 28% less risk of having diabetes, less cardiovascular mortality, all cause of death decrease. So there's many studies saying it is beneficial to get outside. So this is from Ministry of Healing. Nature is God's physician. Pure air, the glad sunshine, the flowers, the trees, all have healing power. And she says, outdoor life is the only medicine that many invalids need. Its influence is powerful to heal sickness. So we heard this over 100 years ago. I'm going to move along there. So this was a study that combined UVA exposure and COVID-19 mortality, and adjusting for co-founders. They found that the more exposure you got to UVA, the lower the mortality with COVID-19. And this was in the USA, England, and Italy. This is the USA graph here. The more UVA exposure you got, the less the mortality. Same for England and Italy. So it was a clear link to farther south you were, the better it was. And they said the effects appear independent of the vitamin D pathway. So vitamin D can be helpful for your immune system, but just being outside has other benefits. And this is another study showing that latitude was associated with COVID-19 mortalities. This was in January 2021. They looked at the autumn COVID spikes in Europe in the autumn of 2020. Temperature had no impact on it. The humidity had no impact, but the latitude did. The more northern Scandinavian countries got it first, followed by the southern countries. So there was, again, all these studies showing how sun exposure is very important. So for the sake of time, I'm going to move along. This is one fascinating study, and then I'm going to share a little story with you about a patient. So this was a study out of Brazil, and they had 30 inpatients, and this is during COVID, and this is the picture from the study. They used this vest, and it was 940 nanometer infrared. One group got it, and the other group didn't. They were blinded. There's no lights. It's invisible spectrum. And they found that this is just for 7 days. Those who got the infrared, they had 4-day less length of hospital stay, their oxygenation, respiratory rate, lymphocyte count, and there was overall clinical improvement was better in those who got infrared. So it was a randomized, blinded study showing that infrared has a potent impact on people who are admitted for COVID-19. So it's not just vitamin D. Having a room in a hospital next to a window, there's better outcomes in a number of measures. And fresh air, sunshine, very important. The light and the warmth of the glorious sun have life-giving, health-healing properties. And we saw this in some of the sanitariums back in the day. A big part of the treatment was getting outside. And this is the Battle Creek Sanitarium, light cabinets that they had back in the day. This is one I found online where they treated tuberculosis, not in Adventist hospital, but they used this same technique. So this is a case study that I got from MedCram. Does anybody know who Roger Suelt is? So I know Pastor Mahoney knows, but he's, in fact, I Googled and I did ChatGPT, who are the most listened to Adventists in the world right now. And this guy is number one. So you should follow his website is medcram.com. He puts things out. He's recently interviewed on Huberman, and he's been on Diaries of a CEO, that's second most listened to podcasts in the world. He's an Adventist physician in California. And so I'm getting this from him, but it's been shared all around. This is a 15-year-old guy, a young gentleman. He was diagnosed with leukemia. He had started chemotherapy. He got sick. He had a CT showing a pneumonia, and it was a fungus. And it started him on strong antifungal medications. And the CT went on to show he came into the hospital at the beginning of June. By the end of June, a CT scan showed necrotic tissue. They had to take out his left lung. So they took out his left lung. He went back to the ICU. And middle of July, he's having worsening oxygenation. They get another CT scan. And this is what they see. So this is the, here you can see where the lung was taken out. This is actually the left lung, because you're on your back, feet coming towards you. This is the left side. Where on the right side, the remaining lung, only the lower portion of the lung had any oxygenation occurring. Everything else, there was a fungus with fluid at the mid and top portions of the lung. So he was a sick guy, not responding to these strong antifungal medications. And so they decided they couldn't take out the other lung. You need a lung there's really no surgical options. He was not responding to the antifungal medications. And they gave him 2 days to live. Like he's a 15-year-old kid. And he said, what do you want to do? Like, what would you like to do? He'd been in the hospital over a month. What do you think he asked for? He wanted to go outside. So he went outside, and these are his numbers. So July the 17th, he went outside for 4 hours. His white count was very high. Anything over 11 is elevated. Neutrophils were quite high as well. Day 2, he went outside again. Lo and behold, his white count's lowering. The fever is gone. Day 3, white counts normalizing, neutrophils normalizing. And they're like, wow, what is going on here? They repeat a CT scan. And so this is what you saw before. And let me see here. It's going to come up, hopefully. Okay, here it is. So you can see how the fungus cleared. And the only thing different he did was go outside. And so this is a case report. It's not a randomized trial, but powerful. That just getting outside, the benefit that we underestimate the power of sunlight. So, and interestingly, now 93% of our time is indoors. So we get very little outdoor exposure. This is looking back from 1800s to present. And our light bulbs, we used to have incandescent light bulbs, which this is in the near infrared range, which gave us near infrared exposure. Our current lights that we use, the LED lights, it's very energy efficient, but it takes out all infrared. So we're not getting any infrared from that. And the windows we use are very energy efficient. They block also the much of the infrared. So we're getting very little time outside, and a lot of things we have for energy efficiency has cut out what we typically do. So that's we talked UV, visible, infrared, and most of us get very little time outside. So we oftentimes underestimate the power of light. So I'm going to stop there and invite Dr. Tryon up. We have one question here.
Sunscreen you wear?
Oh yeah, good question. So yeah, sunscreen blocks vitamin D. It doesn't block infrared exposure. And you don't want to get too much sun. You can get skin cancer and everything. So probably like I said, 10 to 15 minutes for lighter skin, 30, 60 for darker skin. But sunscreen does clearly protect you from UV rays, but it doesn't block infrared. Yeah. All right. So why don't we wait, we have one more question in the back, then we go to Dr. Tryon.
Say if you keep those stickers go sarcade, God, what the sunrise removal?
Okay, so she said that if you watch the sunrise, you're outside for 3 days in a row, just in the mornings. just watch the sunrise. It resets your circadian rhythm 3 days in a row. So you get your circadian rhythm going. So for just 30 seconds, I'm going to have you stand up, stretch your legs, and then we're going to get Dr. Tryon up here.
Yeah. Had a laboratory question. That case study in the last one.
Yeah.
Had ALL.
It was chronic lymphocytic leukemia, I think.
Yeah. So how come is
Me too. Okay, yeah. Yeah. Finish it. Yeah, it really. Yeah, I will. I'll answer that obvious. But I had these things. Yeah. Especially people trying to do quick.
So like that? Yeah. I'll leave that water for you if you want. Thank you.
oh, so over bloodstream?
Appreciate that. Yeah. This worked okay for you this time? This is the last. Yeah, you can use this if you want to, or you can use them that or either way. Okay. Hey, there was one question on vitamin K2. So sometimes you'll see vitamin D comes with K2. K2 drives, if vitamin D helps calcium get absorbed, K2 helps to drive it into bone and away from like blood vessels and things like that. So K2 could be helpful from that perspective. Different than the vitamin K with the coagulation and such. All right, we'll have you have a seat, and then we're going to turn it over to hydrotherapy with Dr. Tryon.
This afternoon, we're going to be talking about hydrotherapy, and I could have gone on and listened another 20 minutes to him. Don't you think so? That was terrific. That was terrific. Going to be talking about hydrotherapy. Before we do, let's have another word of prayer, if you don't mind. I always like, before I give a hydrotherapy treatment, to have a word of prayer as well. So, can't hear me? All right. Can we adjust that? I can shout a little bit if you want. Let's have a word of prayer at this time, asking the Lord's blessing, and then I'll speak up better for you. How does that sound? Kind Father in heaven, thank you so much for the privilege of simple things that you've made for us, that we may have a better quality of life. Help us to not only appreciate those blessings, but to appreciate the giver of those blessings. In Jesus' name, amen. Hydrotherapy. Let's take a look at some hydrotherapy. You know, the thief comes to destroy and to kill, but Christ says, I've come that they might have life and have it more abundantly. The more we study about the human body, the more we find we don't know. And for Psalm 139 tells us, you formed my inward parts, you covered me with my mother's womb. I'll praise you, for I am fearfully and wonderfully made. Marvelous are your works, and that my soul knows well. Let's begin with hydrotherapy to see the effects upon the immune system. The immune system has basically two categories, the innate immune system and the adaptive immune system. The innate one is getting weaker with age, and the adaptive is stronger with age. The innate is getting weaker with age, and that's why the children tended to not get so sick with the COVID-19, but the older we get, the more likely potentially complications of it. The innate is the first responders. It gets weaker with age. It's non-specific. They just say, this is a germ, let's get rid of it. But the adaptive has special antibodies to fight off current and recurrent infections, and it actually gets stronger with age. Interferon is a very important part of the immune system. It's a key part of the innate immune system. Interferon is one of the fastest frontline weapons, especially with viruses. It interferes with viral and bacterial infections. Type 1 is the one that helps for early onset to get in there and get going with a quick defense system for your body. Type 2 helps the two systems to work together more efficiently. So viruses and interferon are at a battle. Who's going to win? Well, there are things we can do to help our interferon. Interferon does battle with the viruses. It activates natural killer cells and kills infected cells early, turns on genes that produce proteins that fight against viruses. Very important for us to have that. In severe acute respiratory syndrome and Middle Eastern respiratory syndrome, those who had a higher interferon level did better. Those that had a lower interferon level did not do so well. And so let's take a look at the severity of disease correlation with interferon levels. The black line is for no infection. Once you get exposed, if you have a high level of interferon, you have a milder disease. If you have a critically low level of interferon, you have a much worse likelihood, a much more common likelihood of having critical response. The severity of disease is correlated with interferon levels. So again, as I said, the higher the interferon level, milder the disease. The lower the level, the more severe the disease. There can be problems with mutations in autoantibodies, but there are things that can help the body. What happens if we give hydrotherapy and we heat up the body? What happens to our interferon? A tenfold boost in the interferon level. So if you're taking hydrotherapy and you have that nice heated up in your body, it can boost your interferon significantly. By the time you reach 102 degrees, look at the increase in the gamma interferon level. So slight increases, even temperatures of 100.4 have some difference. You notice that children tend to spike fevers more than adults. With infections, you can come in critically ill with sepsis. You may not even have a fever. You may even be subnormal sometimes. And actually, that can be a complication. So interferon has a marked increase in genes that target it. It does make a difference if you have adequate interferon levels. Put them in a warm bathtub, temperature 103 for an hour, improves the monocytes. The monocytes are cells that fight the infections and also do a good cleanup job afterwards. What about if you follow it with cold? Hydrotherapy, hot followed by cold. Let me get going over this way. Is it helpful? In fact, we can look at that. We look at it for several different ways. We'll put someone in 95-degree water for an hour, 100.4 degree water for 60 minutes, or exercising. Hydrotherapy mimics exercise. And as it does that, it actually, some people are just too sick to exercise, and that's why hydrotherapy can be a big blessing. All are exposed to getting the temperature in the cold side from 41 to 60 degrees, and it made a significant boost in the boosting of the natural killer cell activity. Exercise also helps that. What about saunas? Saunas are done in what country more than any other in the world? Finland. 99% of the population use it at least once a week. There's enough saunas in Finland for everybody in the country to take one at the same time. They have plenty of saunas there. It's an increase in, I don't think we have a 99% use of saunas here in this room. Increase in heat shock proteins, enzymes that improve the immune response, improve protein folding, and improve cytokine release. That's the interferon. Mitochondrial, we talked about the mitochondrial, how the sunlight is helpful. Guess what? With hydrotherapy, one of which has been most heavily studied is the sauna because of the availability in the country that's using it almost exclusively. It actually causes mitochondrial biogenesis, makes new mitochondria, makes more efficient powerhouse of the cell. So what's the conclusion? When you put it in the cold, when you fall in hot, followed by cold, you have a fall in core body temperature resulting from cold exposure that leads to consistently and statistically significant mobilization of circulating cells and increases the natural killer cell activity, increasing your interleukin-6 concentrations. When we draw your blood for a blood count like a CBC, we think we're getting all the white cells, and we can look at it and say, what's your white cell count? Actually, the blood vessels contain a lot more white cells that are not moving. They're attached to the walls. And when they get activated, like a reserve military, then the count goes up. We did studies on a patient when I was a medical technologist in North Georgia, and I found a patient that was sick and was willing to be tested. We started with a hydrotherapy, drew blood before we began the therapy, gave him the hot, cold, and checked it, and his white count went from 4,500 to 11,300. And even after we stopped it, it still came down to over twice of what the baseline was, because there was mobilization of the marginal pool. Those cells that line the vessels were stimulated to be released to make an increased active military in your body to fight significantly. So, what are the options? Contrast shower. I've been taking hydrotherapy since I was 12 years old. My father was a physician. Said, Randy, you really need to get into hydrotherapy. It's really good for you. And so I've been doing the hot and cold ever since. And I enjoy it every day. I don't enjoy it as much when I go to Florida because the water is not very cold. And if you're used to it, it really is invigorating. We'll come to that in just a minute. There's hot tub therapy, which is the one that keeps the cord heated up longer, the sauna, and the fomentations. Be careful with hydrotherapy. If you have a heart condition and you have an unstable heart condition, going into a contrast shower, hot tub, sauna, and fomentation, the heart rate gets faster and it can lead to syncope or passing out or other complications. So if there's concern about a person who's unstable, check with the primary care or with the cardiologist. What about fomentations, especially diabetics with neuropathy? They may not be able to feel how hot the fomentation is. So if you're putting fomentations on, be careful. Don't burn somebody. Be real careful. And when in doubt, check with the primary care or with cardiology. So how can I do this? I find the easiest way for yourself is a hot, cold contrast shower. It's hot for 3 to 5 minutes and cold for 1 minute. That 1 minute, you may want to cheat and say, I'll get a little one today. I'll just take a 20-second one, a 10-second one. The truth of the matter, we'll come to this in just a few minutes, but the effect upon the brain metabolism is more pronounced if you give it a full minute, and we'll come to that in just a little bit. The hot tub, it can be 104 degrees for 20 minutes and then a cold plunge. Most of us don't have 2 bathtubs, but we can consider that as an option. Sauna is 174 degrees for 20 minutes, 3 times a week. Fomentations, that you may want to write these down. These are websites that you can go to and get some more information on it. I took classes in hydrotherapy years ago when I was a medical technologist before I took medicine, and I still have my hydrotherapy textbook. And a lot of things change in medicine. They say half of what we learn in medical school is wrong. Takes 7 years to figure out which half. There's one medical book I have that hasn't changed in all those years, and that book is the Bible. The Bible. And an excellent book resource also is Ministry of Healing. Does make a difference. So traditionalhydrotherapy.com, uchipines.org/counseling-sheets/fomentations. So what's better? Hot water, traditional sauna, or infrared? Well, as I mentioned, the one that tends to hold a comparison is the hot water is holding the core body temperature better. The traditional and hot water are about the same otherwise as far as overall temperature, mean temperatures. So the core temperature is warmer with the hot water, and the mean temperature hot water and traditional sauna are equal. What else happens when you're taking hydrotherapy and you get that hot, nice and hot, and then cold? First of all, one of the things you can do is you can have some weight loss, and most of that is from sweating. Sweating is more pronounced with the hot water immersion and less so with the far infrared exposure. What happens when you do all that sweating is interesting. We find that the heavy metals have a much higher concentration actually being excreted in the sweat than 17 times higher than in the urine, and even other chemicals that we have exposure to in our society can be excreted in the sweat. The effects on the blood pressure and the heart rate goes up. It leads to the blood vessels getting more dilated. And as they get more dilated, the blood pressure can drop a little bit and the heart rate can increase to compensate. So these are things that happen. As that heart rate, cardiac output increases, the stroke volume with each beat of the heart increases, and the vascular resistance decreases. There's a larger response with hot water immersion. Saunas, Finland, I told you about that, enough for the whole country. And some of them most of them take it once a week, but there's some that take it more than that. And a lot of our hydrotherapy studies come from Finland as a result of the saunas and the control studies and the population that's pretty much 100%. Cardiovascular health is affected by hydrotherapy, and we can extrapolate that from the saunas, it really does make a difference. As we take a look, those who use the sauna once a week had a relative risk of 1 of dying of all-cause mortality from a fatal cardiovascular event. Those who used it 2 to 3 times a week had a decrease in 22% of their all-cause mortality, and those that used it 4 to 7 times a week had a 63 relative risk reduction, huge reduction in the risk of dying from cardiovascular event. So it really does have a positive benefits on helping the heart. It really does make a big difference. And so what happens with the benefits of cardiovascular health, those who are using hydrotherapy like sauna, congestive heart failure, you have less PVCs, the premature ventricular contractions. You have improvement endurance. The heart size, you like to have a big heart spiritually, but you don't want a big heart physically. It's not good for your health. And the ejection fraction can actually be improved with this form of hydrotherapy, the sauna, and it can be extrapolated for the others as well. Ischemic heart disease has actually improvement in the vascular endothelial function, and so the function of the lining of the coronary arteries is actually improved with hydrotherapy. Peripheral artery disease, particularly among smokers, they get buildup of plaque in the vessels of the lower extremities, and as they begin walking, they get pain in their legs, and they have to stop until the muscle demand for oxygen goes down, and then they start feeling a little bit better. What happens if you expose them to hydrotherapy? They have improvement of pain, improvement of endurance, and improvement with blood flow. What about dyslipidemia? Even within 2 weeks, the first 2 weeks of using hydrotherapy on a regular basis, there's already an improvement in your total cholesterol level, and your the LDL, the low-density lipoprotein, actually begins to go down as well. The inflammatory markers also begin to improve. Now, let's take a look at the brain and hormones and the benefits of hydrotherapy, such as sauna. There's an increase in brain-derived neurotrophic factor. Brain-derived neurotrophic factor. That is a protein that has an effect upon cleaning up after the cellular metabolism in the brain. You have cellular metabolism, and as you have this cellular metabolism, there's materials that are left over afterwards that need to be cleaned up. If they're not cleaned up, then you have an increased likelihood of progressing eventually on to Alzheimer's. So one of the things it does is helps clean up after the metabolism in the brain. Not only that, but one of the things that we learned in medical school is that you don't make new brain cells. And once you lose them, you lose them. But we find now with studies, we're finding that brain-derived neurotrophic factor actually causes nurturing and even production of neurons. And it's a blessing that the gospel is a gospel of restoration. God doesn't want to just save us in heaven. He wants also for you and I to be able to have abundant health physically and, of course, most important, spiritually. What about depression? What about the effects about depression? Antidepressant effects of hydrotherapy and long-term antidepressant effect. It really does something to help in the moods. And we live in a more stressful society, I think, in my lifetime than I've ever seen before. And I saw that especially during COVID, when people would be shut up in homes for months and months and have things delivered to their house and never get outside for sunlight, never got hydrotherapy because I didn't know about it, but I taught my patients. And so what happened to the mental health in our society? It made a big difference. Hydrotherapy makes a difference in your mood stabilization. It also has a long-term effect as far as doing that. What about growth hormone? You thought that was just for teenagers and children, but we all need it for improvement of management of pain, for endurance, and for blood flow. It does make a difference. The far infrared saunas reduce fasting glucose levels. I have not been able to have access to far infrared sauna. What about endurance for physical fitness? People that take a sauna twice a week, 30 minutes, increase their endurance, their ability to exercise more efficiently at a longer pace. It also helped prevent muscle loss. Daily heat treatments really did make a difference to prevent muscle atrophy And it does make a difference to have it on a regular basis. These are things you can do in your shower. These are things you can do if you're wanting to help someone else. Well, study up on hydrotherapy because it's going to become more and more difficult to get health care. The amount of no nation can pay for all the medical expenses of all the bad choices that all of us tend to make throughout life, and some more than others. We need to take a serious look at investing in taking care of our health and learning how to help others in inexpensive, easy ways that are effective as well. So before a sauna or other hydrotherapies, it's very important to drink plenty of water. It's important to stay hydrated. I found that I was extremely busy during COVID 2000 to 2024 particularly. And as I did, the number one reason that patients would go to the emergency room, didn't need to be hospitalized, but needed to go to the emergency room, was they needed an IV because they were dehydrated. You got it. But it was a very common problem, the most common problem that I saw, and increased the complications of what they were going through. So make sure you take up on your fluids before taking hydrotherapy. Pregnancy, it's not recommended to take a sauna if you're pregnant, although there are ladies in Finland who ignore that and take it anyway, and I've not heard of any bad reports, but check with GYN and see what they say. Avoid overheating the head. I think that's important. That was one of the things I learned in the class that I took, and as I saw when children were being treated, if you are giving hydrotherapy and you don't keep the head cool, they begin to become more foggy-brained, and so can adults as well. So make sure that you keep your head cooled. Caution with children, they can pick up heat more quickly than adults, so the body surface area is different. If there's any concern, particularly if there are medical concerns, check with the primary care. And with cardiac disease, make sure that you're stable as far as that's concerned. If there's any question, I saw a number of elderly people treated with hydrotherapy, and there may have been one case I heard about that someone may have been affected because they couldn't handle the blood pressure changes in it, and that obviously can be a concern. So monitor the vital signs if you're giving it for someone else. When you go into patients' homes, in your neighbors' homes, to give them some free treatments and to do some cooking for them and some cleaning for them and feeding them and caring for them, monitor their vital signs and see how they're doing, how they're thinking, how they're acting. Standard of care in 1900s was hydrotherapy. Battle Creek Sanitarium, they had hydrotherapy that had a hot water tub immersion. They also used fomentations, making sure that you put 1 or 2 layers between the hot fomentation, 1 or 2 layers of towel between, so that you're not putting the fomentation directly on the skin. You don't want to burn. You don't want to come back the next day and find you got blisters you induced. So avoid a burn. Famous people visited the Battle Creek Sanitarium. While there was Sojourner Truth, the Post was Post Serial, Henry Ford, Eleanor and Teddy Roosevelt, and others. The picture down below is President Taft coming to speak there as well. 1918, a terrible flu. Spanish flu probably did not come out of Spain, but did hydrotherapy help? More than 50 million people around the world died. There was 105 million population at that time, and just about everybody knew somebody that had died from the Spanish flu. More than 2/3 of more than 2/3 of a million died here in the United States. And when the population was much smaller at that time, that was rather significant. So what happened? Well, Dr. Rubble in New England Sanitarium at Seventh-day Adventist had a wonderful opportunity to test the efficiency of rational treatments. And so what had happened as far as that was concerned? Well, there was an Army hospital nearby, and they had actually opportunities for more intense and advanced training than the physicians in the sanitarium. But notice the difference in the sanitarium. The sanitarium chose a different way. They chose to go with hydrotherapy, with fresh air, with rest, with sleep, with sunshine. And the Army hospital had their latest techniques. They didn't have antibiotics at that time. But what they experienced in the Army hospital is 16% of those who came down with the disease ended up getting pneumonia. and almost half of them died from their pneumonia. That was an interesting finding. It was sanitarium, only 2% of those who became ill came down with pneumonia following the regimen of Dr. Rubble. And they found that, yes, 50% about died from pneumonia, but that was 50% of 2%, which means that the fatality ratio was more than 6 times if you were in the Army hospital, where they did not have the benefits of fresh air, sleep, sunshine, and those other things. The Adventist Seminary in Minnesota had 120 students exposed. 90 got sick. None of them became very sick. No deaths involved. This hit the news. The county health department published this and says, wow, this is really something. How are they doing this? Well, they would monitor them, and as soon as they got sick, they'd put them to bed. They'd watch their temperatures carefully, symptoms, keeping them hydrated. They used isolation. They used fomentation. They hydrotherapy, hot towels to the abdomen, chest, and abdomen, and they found that they did so much different. They had 120 exposed, 90 became infected, no deaths, and no serious illnesses. In summary, hydrotherapy and heat boosts the innate immune system. Interferon is increased. White blood cell number in circulation as well as in activity does make a difference. The cold after hot appears to boost the immune system even more. Cardiovascular deaths are benefited. Neurologic benefits, we looked at those, as well as physical fitness. And spiritual benefits. Don't you know that your body is a temple of God? You're bought with a price. Glorify God in your body, which is God's. Well, all gospel workers should know how to give the simple treatments that do so much to relieve pain and remove disease. I'm running out of time for you because I kept you longer yesterday. I apologize. You want a short story or not today? All right, meet Danny. Danny comes to, thank you. Danny comes I go to see him. I took care of all my own patients. This is the danger, isn't it? I took care of all my own patients, 365, 24 hours a day for 3 decades, and I loved every minute of it. Hospital, office, nursing homes, hospice, whatever. And during hospice, I took care of patients like that, take care of all my own patients in the hospital. And Danny, he was treated in the emergency room, sent home, and I treated him and repurposed medications and metabolic interventions. Metabolic interventions, what does that mean? Nutrition, exercise, water, sunlight, fresh air, rest, stay away from things that are bad for you, and trusting the heart of God. Danny was getting worse. He was a diabetic, not doing real well. I said, Danny, you need to go to the hospital. He says, I don't want to. I'll just stay home. I think I'll be all right. I said, Danny, your oxygen saturation is critically low. You get over there right now. You need to get an ambulance. And no, I'll get my wife to take me. He went straight into the intensive care. And interesting, but I went ahead and I treated my patients differently. And I'm not ashamed to say so. One of the first things I would do is pray with them. I don't care if they're a Christian and teach them about Jesus. If they're not, I'd ask them 3 questions. I always put through 3 things. Let's ask the Lord to make sure everything's right with our soul, that He forgives all of our sins by the blood of Jesus. The second thing is let's ask Him to make us better. And you know, He's going to make you better some way or another. We'll leave it up to Him. His will be done. And then we want to thank Him for whatever He decides. And I do that consistently. And I found that God blessed. And yes, there was a patient or 2 that died, but most did quite well. And I give the glory to God, not because of anything that I did, but there are things that we learned that can help. I love to teach my patients how to do their own hydrotherapy. And if I couldn't get, we don't tend to have the hydrotherapy departments anymore that we used to have in our facilities. And so I would teach them how to do their own hydrotherapy. And I would also encourage him to make sure he drinks his fluid. I'm not ashamed to say I put my patients consistently on a plant-based diet throughout the hospital. And if they demanded otherwise, I let them have it after I explained to them the dangers involved. And almost always they'd say, oh, you mean that may have caused my stroke? You mean that may be why I'm having a heart attack? Yes. Well, then go ahead, put me on a better diet then. And they would let me time and time again because they wanted to have a better quality of life. Danny was seen by me every day, often 2 or 3 times a day. And he was also seen by the critical care physician, who was not a Christian. who would come in, and he was well trained as a critical care pulmonary medicine doctor. And as he came in, he'd say, "Danny, your sats are barely hanging in there on Vapotherm 30 liters of oxygen, heated oxygen. So we had to put you on, Dr. Tryon put you on BiPAP to help you breathe better. But the next step is a ventilator. And once you put it on a ventilator, we've already got a room for you at another facility that can take care of long-term ventilator because you'll never come off of it." And he told him that every day, day after day, week after week. And Danny said, "Thank you. I'll talk to Dr. Tryon about that." He said, "Well, you really need to be on a ventilator. I'll talk to Dr. Tryon about that." And we prayed and we kept working together. And Danny gradually began to get better. And as he did, he finally walked out of the intensive care 30 days later. And that doctor came and said, "I'm going to have to sit down with Dr. Tryon and find out what his secret is." We don't know it's what his secret is. It's who his secret is. I saw this happen again and again, and all gospel workers should know how to give the simple treatments that do so much to relieve pain and remove disease. So go look at those websites, look it up, and start using something simple. If you have a hard time with that cold plunge, all right, do the summer rain in August where you turn it just a little cool as you get used to it. But once you get used to it, it makes a difference. I don't have time to go through all the benefits of all the different neurohormones that are affected by that cold blast lasting for 60 seconds, but it does make a huge difference. Any questions before we close? First hand back here. If I miss you a hand, I'm sorry.
But you said the second in 1 minute. How long they get? What? 20 minutes?
No, no. A contrast shower, a hot shower, as hot as you can comfortably take. Don't burn yourself. And if you have diabetes, you have to be extra careful. And that's often 3 to 5 minutes. And then 1 minute or 60 seconds of cold. And that's generally all. I would wonder, I took medicine for one reason. I was a sickly child and I would get sick easily. And when I would get sick, I was interested in health and I began to study the things that I eat and taking hydrotherapy. And I found these things worked. And that's why I believe in them.
I think that how many times?
Right. And one of the things that I do is when I was working with COVID patients, sometimes I'd work 22 hours and then I'd come home for a few hours sleep. And then I'd go back to work and I thought, am I feeling tired or am I coming down with something? I would go home at lunch and I would take a hydrotherapy and I'd take hot, cold, and always finish on cold. It does make a difference. I did it 3 times. Sometimes I'd do more than that if I was concerned. And I never really got terribly sick. And I maybe a scratchy throat, but who knows if that was from sleep. But I never really came down with symptoms. But I did test later on, found out that in fact I do have had exposure to COVID, but don't have long COVID. So it did make a difference. I'm sorry if I had questions. I saw your hand up longer than anybody else's.
Did you put that slide up that had to do with the contrast showers? It was one of the first when you started.
Contrast showers? I'm not sure which one you're talking about. Okay, hot tub is 100. What is your question? See if I can get it to you.
I wanted to have the chart of the question they were asking. I was going. Yeah.
Okay. Sitting in 95-degree water for 60 minutes or 100.4 degrees.
Study. That was a study. The slides are available if you look at the QR code. Yeah.
All right.
Oh,
Yes.
Is there a better time, morning, evening, for doing the hydrotherapy?
I find I do it in the morning, and I find it's when I wake up, I don't need coffee. I drink a gallon of water, not a gallon. I drink a half a gallon of coffee a day. I just leave the bean out. Because I want to think clearer and I want my metabolism to function better. You can go with that, yes, as well. There were other hands up. I think that's everything. I was going to finish with this. I want to see if I can come through. That's okay. I wonder if there's no other questions, may God bless you as you pursue life and health. Health is a matter of choice. Choice is a matter of lifestyle. And the choice is yours. God bless you as you seek life and health, and may you find it more abundantly. Thank you.
Thank you, Wookie.
God bless.
Worry Ward. Just wanted to thank you so much. I appreciate your.
You're welcome. God bless you. Did you get my email address?
No, I didn't.
I send out a blessing every morning